Well, why don't we go ahead and get started? I know there'll be people continuing to join us as they um, start their lunch hour, but I am uh, really excited to have the opportunity to introduce our speaker for today. We are welcoming Dr. Joseph LeHoulier here today to speak with us about the anatomy of gossip, dissecting dynamics and impacts in medical education. So Dr. LeHoulier is a PGY 5 general surgery resident physician at the University of Buffalo, where I'm sort of blinded by the sunlight today, but he says the sun does not shine there. So we'll have to share our Colorado sunshine with him virtually. He received his undergraduate and medical degrees from the University of Wisconsin School of Medicine and Public Health. During his academic development time, he was the Empire Clinical Research Investigator Program Fellow through the New York State Department of Health, studying outcomes following trauma. He also earned his Master's of Health Professions Education from the Massachusetts General Hospital Institute for Health Professions Education and studied the role of gossip in surgical education for his thesis. Throughout his training, he has been involved in the Association for Surgical Education as an active member of multiple committees and the co-chair of the international group known as COSEF, the Collaboration for Surgical Education Fellows, who works to promote scholarly collaboration and mentorship amongst trainees with a passion for making surgical education better. So again, we are really excited to have you. Dr. LeHoulier, I'll try to monitor the chat for you and we'll give you the floor here. Welcome.
Sounds great. Well, thank you so much for the invitation. Thank you all for being here today. Really excited to share some interesting work. I hope you all find it as interesting as I do. So let's jump right in. So this is the anatomy of gossip. We'll talk about dynamics and impacts in medical education with a focus certainly on surgery. So just some disclosures, like Dr. Adams mentioned, a lot of this work was part of my Master's in Health Professions Education thesis through the MGH IHP. There's a preprint copy of everything I'm about to share today available at that link there. The peer review process is taking place. Currently, this is submitted for consideration at a journal, and I'm actually excited to present the contents of this talk at Clinical Congress here in a couple weeks in San Francisco. So before we get really into the content, I want everybody to think for a moment about gossip. So when was the last time you would say you heard gossip? What was it about? And what were the impacts of these conversations? And how do you even define gossip in the first place? So I'm just going to pause for one quick second and just see if anybody is brave enough to throw some thoughts in the chat. How would you define gossip? Let's start with that. What do you think? Hard to define. I think it's one of those things, right, where we know when we see it, but to put some words to it is tricky. Juicy tidbits of secretive info. Yes. I think that's kind of along the lines of what most people would intuitively say. Talking about somebody else when they're not there. Okay, that's actually very spot on. Non-email worthy updates. Yeah, something you heard from someone else may or may not be real. Hearsay incorporates hearsay. Yeah, okay, so some good thoughts. So the academic definition created by social scientists is basically exactly what someone here put in the chat. Evaluative talk about an absent third party. Not necessarily positive or negative, but I think most people tend to have negative connotations associated with it kind of intuitively. There was a 2019 study that sampled audio segments from conversations of over 450 people during a 3-day period. And they found that on average, we spend 52 minutes per day engaged in gossip. And while the intentions behind gossip may vary, these conversations ultimately build and maintain the social networks that make us human. So what about gossip in healthcare? So I would say that it has both positive and negative impacts. So, for example, gossiping, I would say, does have a role in maintaining a sense of belonging and inclusion within a group. Well, it can also, on the flip side, propagate harmful misinformation about others. So researchers have shown that gossip among nurses, for example, can have potential downstream impacts, even all the way down to patient care. Nevertheless, gossip in surgical residency, specifically general surgery, has never been studied. General surgery residents frequently face high stakes clinical situations, as do many healthcare workers, be it physicians, nurses, technologists, kind of everybody who interfaces with patients. These situations mandate communication with a whole bunch of different stakeholders: patients, families, attending surgeons, other attendings, nursing staff, and each other. Given this high frequency of interpersonal interactions, we hypothesize that gossip not only occurs in, but likely affects the surgical learning environment. And ultimately, can all this impact burnout? So ultimately, these were sort of our research objectives. So first, we were hoping to construct a process model for how and why gossip occurs in general surgery residency. Two, uncover the positive and negative impacts of gossip. And then three, finally, to determine how to enhance the benefits while limiting the drawbacks. So, sorry, I'm just managing my screen here. Give me 1 second. So to achieve these goals, we essentially ran this project through COSEF. So COSEF is the collaboration of surgical education fellows. This is a multi-institutional resident-led group of surgical education research fellows from across the country to join this initiative. And I'm actually very excited to say that COSEF is now a part of the Association for Surgical Education, in no small part thanks to Dr. Gardner and Dr. Shabahang, their leadership. So thank you both. So ultimately, each collaborator at one of the institutions highlighted in the blue states here was instructed to recruit 4 participants from their institution through purposive sampling. Any categorical general surgery resident at their institution met inclusion criteria. So ultimately, we had 9 collaborating institutions across eight different states throughout the United States here. And I'm excited that every geographic region was included in this initial study. Now, each of the 4 participants that were recruited at each of the 9 institutions participated in a semi-structured interview for a qualitative research project. So ultimately, we created an interview guide using relevant framework from the social science literature. So as the project lead, I conducted all of the interviews, and due to the potentially sensitive nature of these conversations, I didn't ask anybody from my institution to participate. So I first started by asking them just what I asked all of you, what comes to mind when you hear the word gossip? Afterwards, I provided them with the academic definition that I provided all of you, evaluative talk about an absent third party, to establish consistency throughout the interviews and establish a shared language. So then I asked them to simply tell me about gossip that was recently shared with them in instances where they had it, where I guess 2 instances. First, I asked them, when's the last time you heard gossip? And then second, when's the last time you shared gossip? Afterward, I did some prompting. Why was this information shared? How did you feel afterward? How did you respond? And ultimately, by definition, semi-structured interviews are just that, semi-structured. So as the researcher, I sort of took the liberty to really prompt, to really get people to think and reflect on their experiences with, again, the goal of us trying to put together what is gossip and how does it work in surgery residency. We conducted a reflective thematic analysis of the transcripts using a grounded theory approach. So to briefly illustrate this for those who might not be familiar with qualitative methods, 1 participant said the following sentence to me: some of gossip is, totally positive and benign and, keeps social systems working. So as we read that, you can tag or code pieces of these sentences to help you describe what you're hearing. So I might read this and tag positive. So this participant is saying that gossip has positive impacts. And then I might tag keeps social systems working as connectedness, right? Speaking to the idea that gossip influences how we are socially connected to each other. So the study team and I met several times to agree on codes and establish a code book for all of these different things that we're pulling out of the interviews. The codes are collapsed into categories, and then eventually we construct themes to describe what we're seeing amongst the data. Here are the participant demographics. The majority of the participants were female, the majority were white, majority were non-Hispanic, and then most of these participants were PGY 3s and 4s, although we had every PGY year represented in our data. And most of these participants were single, although many of them were married. And these came from a wide variety of clinical interests, as you can see there. So the next way to sort of break down this data that we found helpful was to create a process model illustrating how gossip occurs in general surgery residency. So initially, I sketched out my ideas on a napkin, and then I turned them over to the very talented Irene Yu, one of my former co-residents, who actually has done some work in medical illustration. So she built the visual impact here of the study. So I'll credit her for that. So the first step in gossip is this gossip target. So the person that the gossip is about will have some event occur. So here we illustrated the gossip target engaging in maybe lazy behavior at work. That's the gossip content. This behavior is perceived by another individual who will ultimately become the gossip sender, or the person who shares this gossip with others. The gossip sender ultimately shares this gossip with the gossip recipient. They probably have some sort of intentionality behind why they say what they're saying. Maybe the gossip recipient likes the gossip target, or the gossip sender wants to change their mind about them. There's some sort of dynamic here. The gossip recipient also plays a role. They have the option to participate actively in the gossip or resist to some degree. And this interaction, of course, can take place in a variety of times and places, either within the clinical environment or outside of the clinical environment. And then finally, the gossip recipient can decide what to do with the gossip. And this is perhaps the most interesting part. So we found kind of four main pathways that the gossip recipient can take as far as what to do with this information. So the first is that they can change their perception of the gossip target. So, wow, that person really is lazy. Second, they can choose to perpetuate the gossip or share it with others. Third, they can talk with the gossip target directly about what they heard, try to get to the bottom of a situation, or provide support. And then finally, they could attempt to seek a resolution, which may be a preferred outcome of gossip. So maybe, for example, they heard that the resident was being lazy, but maybe it was more like they had too many things going on to tend to a specific task. A potential resolution might be something like bringing the high workload of a particular rotation to the attention of the program director and see if we can bring a higher number of residents to that service, for example. And here's the entire process compiled. Again, I'll just note that all of these pieces take place within a particular program culture, right? So some programs are going to be, fraught with gossip. Other programs might have a culture of, not engaging in harmful gossip specifically. We'll get more into that with some of the themes. So now I'll illustrate each of the 7 major themes that we found. And I think some of these quotes are really interesting, and I hope they really kind of highlight some of the struggles of resident life. So the first one is this: the definition of gossip is elusive, yet it can include both positive and negative connotations. So most participants did define gossip as negative talk, but several did give examples of positive gossip, like this one. I gossip about people in a positive way. I'm frequently like, oh my gosh, this person is so cool. I did this case with her and she is so smart. You want to do cases with her. Because of the negative connotation of gossip in popular culture, some participants did not consider negative content with positive intent as gossip, which blurs the lines between positive and negative gossip. If someone had a negative experience with the individual and wanted to discuss it, I don't see that as gossip because they're just trying to talk through a problem with a friend. Second, gossip contributes durably to one's reputation. Typically, participants describe the potential for negative reputations to develop early in residency. Once you establish a reputation with the faculty, it sticks, and it's really hard to shake. There are some specific examples of residents who didn't get off on the right foot when they started as interns, but really turned things around, but they still get treated a little differently. Third, gossip can be used as a form of social instruction. Informal conversations about others' mistakes can be used as learning opportunities, although the lesson may be incomplete. So gossip is like M&M. It's really helpful for us. You hear about these negative things that have happened in the past, And it does make you more aware of the pitfalls that you could run into. But with gossip, the person who actually made the mistake doesn't get to share what they learned from it, which is probably the most important piece of it all. Fourth, gossip flourishes in environments that lack transparency and among those experiencing burnout. When decisions are made without explanation to those directly impacted, gossip inevitably occurs, especially when people feel overworked. So I was on a team with a co resident who got pulled out of clinical rotation. No one got an explanation. Of course, we're all a little bit peeved because it sucks to have your schedule change last minute, especially getting pulled to cover the worst rotations, losing days off, and in some cases, almost violating duty hours. Almost instantaneously, people identified this resident and people were making up whatever stories about their absence that made sense to them. Fifth, gossiping across a hierarchy may force those lower on the hierarchy into uncomfortable situations. Some residents described feeling unable to stand up to gossip from attendings. There's such a power dynamic between attending staff, fellows, residents. If I were in another setting, I would have said that's not professional. It doesn't really feel like you can say that to your attending in surgery. Furthermore, sharing gossip about a superior's performance may influence power dynamics. It will be just me and a medical student, and an attending would ask about the junior residents, how they're doing. It was well intentioned, but if I were the medical student, I'd feel kind of awkward. If I were the intern, I don't know that I would necessarily want the medical student knowing my deficiencies. Sixth, remaining mindful of gossip's potential impact can improve culture. So, appreciating the complexity of situations and assessing the potential impacts on others as a gossip sender and recipient can ideally mitigate negative effects. Every side, every story has two sides. When I am both hearing and sharing gossip, I try to keep in mind how the individual that's being talked about would respond to the situation again. Would they feel comfortable in this conversation? And then I try to act accordingly. And finally, the seventh theme, gossip can build or destroy trust. Sharing gossip with others can signal to the recipient that they are worthy of being trusted with information. He must trust me or must see me as a friend because he's willing to share this gossip with me and is willing to let me in on the gossip. It made me feel like I had a bond with him. When hearing gossip from a superior, the gossip recipient may view this as a breach of power and perceive them as untrustworthy. It's one thing, I think, for somebody who is your peer to share things with you. I think it's something entirely different when somebody who is in a position of power shares something with you, especially something that the resident, I'm sure, told this attending in confidence. This made me think twice about sharing things with that attending in the future. So to put together all of the different pieces of this work here, gossip, we are concluding, is ultimately innate to any place of work where people are working together. I think trying to remove or destroy gossip is just going to be kind of it's a task that can't be done. Ultimately, surgical residency is no different in that way from any other workplace. What we can do is focus on promoting gossip that can bring about positive change and decrease hurtful, harmful, and unproductive gossip. So we also tried to put together some recommendations for institutions and then folks at the individual level as well. So first, for the institutional level, we'd recommend transparent communication. Residents expressed that knowing the reason for a sudden schedule change to cover for a co-resident improves willingness to help. People will gossip about change. That's inevitable. So discussing a dissemination plan with the resident, deciding what details that they'd like to share with their co-residents about their situation may reduce factually incorrect and antisocial gossip. And I recognize that not all residents are going to be interested in that. Not all residents are going to be in a position where they feel confident enough in their sort of standing socially with their attendings, where they're going to want to, air the details of their situation. But I think at least having a conversation with the program director or trusted faculty member when something personal happens that impacts other schedules just sitting them down and saying, folks are going to realize that you're not in clinic or not on this rotation or whatever it may be for this week. It's up to you. We can sort of try to get ahead of it and explain the situation to your co-residents as a peer, or we can just, pull you off blindly. Just know that there's a good chance they're going to, number one, of course, realize this. And number two, there will probably be some discussion about why you're not there. That part's inevitable. But if you want, we can try to get ahead of this and explain your situation. And as individuals, we can practice mindfulness and enhance our own emotional intelligence. So, mindfulness is being present in the moment and ultimately trying to become less reactive and more responsive. So, emotional intelligence is having insight into yourself and others in order to more effectively manage behavior and your relationships. So, teaching these practices and principles ultimately may improve gossip culture. It can certainly improve burnout and wellness. I know there's some folks, I think, at Stanford working on mindfulness and emotional intelligence initiatives. There's definitely some good data coming out that this might improve wellness and could impact gossip culture as well. Plenty of limitations to this work. Like I said, not too many people have touched the area of gossip, especially in surgery. But first, there may be concepts relevant to the topic that weren't represented in these interviews. The point of purposive sampling is to identify folks who are, willing to talk about this, who might have a unique perspective that you haven't captured. But we certainly can't promise that, every thought on gossip is contained in these interviews and therefore reflected in the analyses. Second, these findings are limited to general surgery training programs, but I'd be really excited to identify new collaborators, folks in other fields who might be interested in studying gossip in their space and how that may impact trainees, but also attendings. I'll circle back to that in 1 second. And then finally, we learned from residents that attendings play an important role here. They gossip about us, at least we think they do. So getting the attending perspective on gossip in surgical training programs was the second step in this line of work, which I'm excited to say we just presented at Surgical Education Week last year, and it was actually just published in the Journal of Surgical Education. So unsurprisingly, attending surgeons acknowledge that they do gossip, sort of. They try to define it a little bit differently. They will say, well, is it really gossip if I'm talking about talking with another attending about the performance of my residents on service? If they're the oncoming attending, essentially, they should know how the learners are performing. They should know their weaknesses. Maybe they can help them with that. Well, I would argue by definition that is gossip, but that doesn't make the conversation bad or not worthwhile. It just means that we should acknowledge that these conversations have risk, right? These are biased conversations. These are one person's perspective, and they can be impactful, as we illustrated with this first study and in the second study too. Gossip can spread like wildfire. It can really impact people's perceptions. It can impact people's standings within the program. So I think just keeping that in mind, when you're having these conversations with other attendings, resident to resident, attending to attending, resident to attending, and so forth. These conversations have risk, and really just keeping the language objective, at least as objective as possible. So I'd like to definitely thank all the collaborators who've helped me kind of navigate this journey about gossip and study the social interactions within our surgical community. And a big thank you to Dr. Gardner for the invitation. I would bet that this topic is different than what you have all heard here in this lecture series before, and maybe even qualitative work is a little bit outside of your day-to-day, but I hope some of these ideas are interesting. I intentionally made the talk a little bit on the shorter side. I'm hoping we could have some interaction. I'm excited to hear what folks think about this work, any next steps and kind of reactions. So those are all the prepared slides I have. I'll stop there.
Thank you so much, Dr. Lujulia. This is a fascinating conversation. I'm a mom of twins too, so I love your final slide.
Thank you. Thank you. Obligatory.
I'd love to entertain others' questions too, but maybe you wouldn't mind if I jump in here first. My education focuses in undergraduate medical education. And one of your final topic is really fascinating to me. One of the things we've worked hard on in our School of Medicine is the sort of the concept of feed forward or educational handoffs, how to ensure that our students who are both doing well, but also, and maybe in particular, our students who have struggles or learning gaps, that we're able to effectively communicate that forward without introducing negative bias. It sets up our students sort of with the bad reputation that you talk about, but almost a learning prescription or our strategies that we can take lessons learned and continue their path to success. So we're not reinventing the wheel every time they start over. And one of our strategies has been to include students in those meetings as a way to minimize the gossip and try not to have any conversations without students there. We did a study or sort of a descriptive paper with several other institutions and found we were the only ones doing that. So I don't know what your response would be about that as a strategy to minimize the gossipy feel, to include trainees as part of the conversation if you've seen that at other institutions.
Yeah, that's a great question, Dr. Adams. Thank you. So you're right. I've seen them written about as learner handovers. It seems like it's the same idea, right? So they happen in surgery all the time. Attendings telling oncoming attendings as the outgoing attending about their learners. I agree that it has some positive impacts. You don't have to reinvent the wheel. You know what their gaps are, but it feels kind of icky, right? As a learner to know that these people are having these conversations behind your back. So before you said it, that's what I was thinking too. Some people have suggested bringing the learner into that space and just saying, hey, let's talk about it. The outgoing attending, the incoming service attending, and you. Let's talk honestly and openly about your performance, where your gaps are, and let's make a plan to sort of mitigate that. So congratulations on doing that. What's the feedback been from your learners? I would guess, based on what I'm reading, that they like being involved, at least the opportunity to participate in those conversations.
I will say it's mixed. I think some students, I think we'd like to think that all of our students have this growth mindset and see it as an opportunity to foster that. I think a lot of
Mm-hmm.
students still see it as pretty stigmatizing. Like, I don't want to be the student with the handoff. And some even pushing back pretty hard on having the handoff at all. So I think we are still in the process of trying to frame this as a supportive environment. And I think one of our other challenges is that it feels hard sometimes to have the real conversation with the student there. And then we're left several months later when a problem arises being like, why wasn't that handed off? Why didn't we know about that? And then the obvious answer is like, well, because no one was willing to say it with the student there. So I would say we're I think moving in the right direction, but there are challenges that still persist.
Mm-hmm. Yeah, I think one thought, I know this is definitely resource intensive, but to just normalize the idea of a handover, right? If you're doing this at the medical school level, maybe not feasible, but at the program level, it certainly would be, where everybody has a learner handover. Everybody has something to gain from this process. Everybody can and should ideally go through some reflective process to identify opportunities. So I think, if you had the manpower, that would be sort of pie in the sky, at least in my opinion, kind of an initial gut reaction to that.
Yeah, I think it's a resource issue. We have our students reflect
Yeah.
and then turn over that written material, but certainly doing those in person is a manpower issue.
Hmm.
It looks like Dr. Gardner has a question. Let me pass the baton.
Yeah, Joe, thanks so much for this. Love it. And I love that you're kind of continuing kind of the theme of research and utilizing that network of the COSET Fellows. One kind of just question I have for you is kind of, what's your take on, is gossip positive, negative, neutral, depends on the situation? Like I can think of many circumstances in which gossip like brings people together, like you're talking about, like residency setting, like having the residents kind of commiserate, like share knowledge, share information when there's so much uncertainty, when there's so much dynamics, high stress. Like I can see that kind of like helps build relationships, helps the communication flow. I did my dissertation on workplace politics, which I feel like has a lot of the same themes of like
Wow.
thriving and like when there's not
Hmm.
great communications, or when there's lack of structure, et cetera. And one of the big takeaways from my work was, depends sometimes on the person and their like environmental influences. On sometimes workplace politics are beneficial, and sometimes they're threatening and kind of can lead to stress and burnout and such. So What's your kind of appetite for gossip so far? Like, are you leaning down and more towards the left of negative of like we need to stamp it out, or do you think it just kind of depends, or a little bit more positive?
Yeah, thanks, Edgar. Yeah, that's a question I get a lot when I talk about this. I think regardless, it's here to stay. I don't think it's possible to fully eliminate it from any setting, workplace, at the home even. I just don't think you can stamp out gossip even if you tried. The same is probably true, I would argue, of workplace politics. Would you agree? Not stamp outable, right? But anyway, so I think with that in mind, we just have to work on keeping it as goal directed and positive as possible. So in my personal experience, I definitely think it can be positive. I see day-to-day examples of positive gossip. One example is I was just talking to the chief at my next rotation. I was just saying, hey, I worked with the person who's going to be our intern before. He's awesome. He's such a great guy. He has a great work ethic. He's going to be a great asset to this team. We're going to have a great month. And I think that's gossip, right? I'm talking about his my evaluation of him as a learner, but certainly in a positive light, right? Getting people excited to work with him and sort of pumping him up a little bit. So after I did some work on gossip, I started seeing this behavior, right? That is positive gossip. And I do that quite often. I'm no saint, right? I think everybody, if you're being honest with yourselves, also participates in some negative gossip from time to time, which I think just having this conversation will help you identify that in your own life, at least for the next couple of days while it's kind of fresh on your mind. But ultimately, I've seen the flip side, right? I've seen people develop really nasty reputations that aren't deserved because of one or two bad instances that happened to them, and the gossip just kind of took hold, became more and more personal, became less and less factual, right? So I think the most important thing is just to acknowledge that gossip can have serious impacts on people's lives. So just being mindful the things that I say matter and can influence people's lives. So to get back to your original question, it's definitely a positive and a negative for me. But I think most people push back on that and they think it does tend to be more negative. My personal view is it can be positive too. Just look for it. You'll see it in your life. There are positive instances of gossip, I promise you.
Thanks.
Abby, Dr. Lara.
Yeah, great. Thank you, Jen. So Jill, amazing talk. This was absolutely fantastic. I love this. And I also love
Thanks.
that you've emphasized also that, yeah, gossip can actually have a very positive impact as well. But being mindful about what is being discussed and the consequences of what's being discussed is really critically important. I am curious. Well, let me give you a little bit of background that's to lead into my question. So I'm an assistant dean for faculty relations for the School of Medicine. And for those that might not understand what that is, it's the office that receives reports about unprofessional behavior conduct, learner mistreatment. So that's the reactive part of the office, but we also do a lot of proactive services as well. We do executive coaching, et cetera. And so and I'm the one who does the intakes when I receive reports about unprofessional behavior conduct. And oftentimes when I'm meeting with the individual, so I'll have two questions, but um, I need to remember I have two questions. The first thing is when I'm meeting with the individual, I often hear, well, I know this person was reported to your office previously. And I try very hard not to emote or respond to that because that is quote unquote gossip, right? And I try to reframe the conversation in regard to I want to understand what your experience is with this individual, not what you may have heard about this individual. So that's one of the important aspects of the work that I do when I receive an intake. I'm curious from your perspective and in the projects that you were doing, did that come up for the trainees in that when they are raising a concern about a faculty member to somebody who's in a position of leadership, um, like either what strategy did you hear about to that was effective in decreasing the continuation of gossip? Or what strategies were good at acknowledging that, yes, there is an impact, but reframe it in a positive way? That's question number one. Sorry, that was a very long lead in.
Mhm. Sure. You want me to take that first before I hear your second one? That was a
Yeah.
lot. Maybe I should do that.
Yep.
Uh, so I think in the space of surgery, we tend to be on the more direct side of communication, which isn't necessarily a bad thing. Uh, One attending surgeon in the attending study said that his strategy was basically this. So when residents would come to him with a problem, he would say, "Oh, that's interesting," and his first question would be, "What did you do about that?" And I think that just sort of puts folks in a frame of, oh, maybe I should be thinking about this from a space of like, could I be providing assistance? Should I have talked to somebody about this? Right? It's interesting when people are throwing gossip at you, just try that. I've tried that a couple of times and they respond in very interesting ways. They pause like, oh, I was supposed to do something. Right. So I think just sort of reframing it in that way might potentially help for one. And then he also said that one of his strategies was just calling it out, just saying, that sounds like gossip. Did you witness this behavior directly? And then oftentimes people say, well, no. And then he's like, okay, well, do you think this could have impacted your perception of this person? So I think just identifying it and calling it out. Beyond that, I would say I don't have a ton more insights to offer. I think this is a really sticky problem, as you have experienced, it sounds like in your position. But I think, those would be sort of my initial thoughts, calling it out and then asking, okay, what did you do about this? And not even necessarily like you were expecting them to take action. I think the situation where it's a resident talking about attending, maybe the right thing to do is no action. That might be true. But I think just getting them in the space of like, okay, well, what would you have done? What are the steps? Is there somebody else you should have talked to? What would be your action plan if this was a different attending? Just trying to put them in the space of what is concrete about this situation. I think that's a technique you could potentially consider.
That's great. And sort of the second question, might be an unanswerable question, but the second question relates to um, gossip that occurs at administrative levels. Maybe a different way to say that is maybe the politics, I guess, or maybe inclusive of that is politics. But what I'm referring to is often in a position also where a faculty member is reported to the office, and I have a process by which I review this in a tiered fashion. Its evidence base is also in a de-identified fashion, and I work within the organizational leadership chart at the School of Medicine for Accountability, meaning working with division heads, department chairs, et cetera. But as in any school of medicine, there are administrative leaders who are responsible for programs, who are oftentimes aware that the faculty member has been reported, and I'm often approached of, well, I heard this person was reported, what happened? And I struggle with wanting to provide them information so that way they have enough information to ensure the successful continuation of the program as well as the culture piece, but also avoiding sharing too much information that is it's not a need to know, it's a want to know. And so a strategy that I've utilized is I will work with department chair and division head, and if there's information that I need to share with another organization, i.e., for example, um, uh, if the faculty member has a medical director role and I need to share that information with the CMO, et cetera, that I will inform the department chair that I need to do this, here's the why behind it, and ensure that they agree with that approach. I'm just curious if if you heard any of that type of gossip at the administrative level in the work that you've been doing, and what reflections you can share with us.
Mhm. Yeah, so I personally have no experience with this, these high level discussions. So that's a huge disclaimer right there. But I think it's interesting. So you said you're focusing on the want to know versus need to know. I think that makes a lot of sense, but that won't necessarily impact whether people engage in gossip about it, right? In fact, they may actually engage in more gossip if they're on the want to know, but not necessarily need to know side of things. So I guess, yeah, some of the attendings did talk about things that would probably get to this level in the attending study. So yeah, there were attendings who talked about, hearing about nasty complications that attendings had, and they had to speak to the dean or some, the department chair and things like that. And the message that I got from them loud and clear is that that gossip definitely goes around, but it wasn't in the way I would expect. So they were talking about, I heard this other surgeon had this terrible complication, this patient died, and they would say, it wasn't something that I shared out of joy in any way. I felt terrible for them. They said, if you do this job long enough, you're going to have complications. You're going to kill people. That's inevitable, unfortunately. So it was more like a support actually, and that surprised me. I wasn't necessarily expecting them to say that they gossiped about, the serious negative things that we do to people at times, but sort of in like a somber, um, almost commiserating isn't the right word for this, but essentially just sharing in the negative experience that just is uniting for surgery folk. So I don't know if I've answered your question, Dr. Lara, but I hope that I've sort of rambled through some thoughts. My understanding is your question is mostly about, how do you navigate the need to know versus want to know? What do you do with feeding that information back to others? Is that correct?
I was more, so yes, but more in the sense of what did did you hear about that particular situation, that particular topic when you were doing your interviews with the surgeon and or the attending study?
Hmm. Yeah, I would say not beyond what I shared ultimately.
Great.
Yeah.
Thank you so much. Yeah.
Hmm. Yeah, absolutely. Yeah, to your point, Dr. Gardner, yes, absolutely. If anybody's interested in these topics, I'd love to hear from you. Dr. Gardner and others on the call have my email. So yeah, I'd be happy to, collaborate in your spaces, learn a little bit about how gossip might work in your area, as well.
Another question from Mary Berg.
Yeah, I was just wondering about what do you do when gossip might extend beyond in-person stuff? For example, if you see something online, like in a chat room or something that relates to this, and especially the example that I would give is something where it was an anonymous source on the online chat, so we don't know how to address it. Like, have you run into that, and what would you do in that situation?
Interesting. No, I haven't run into like an anonymous comment where we talked about asynchronous kind of gossip. It usually happens in text threads. At least that's what people talked about the most. So at our institution, and I imagine many institutions throughout the country, there are text threads of each, class of surgical residents, which are often created out of necessity for scheduling reasons and sharing information about rotations. But in any case, there are certainly these text threads that are happening asynchronously, and there's definitely a lot of gossip in those. Some people did actually share with me instances where something that was said on a chat was actually reported to a program because it reached a level that just was certainly unprofessional. So I think dealing with that is even more tricky. But I think again, ultimately just figuring out who should be notified, who will be impacted by it. So I guess I'll turn it back to a question to you and ask, was this anonymous comment about a person or about the workplace in general? I guess what was the nature of the comment?
It was about the workplace in general. And to give more context, we have a few attendings who routinely visit the sites where medical students tend to communicate with one another, especially
Mhm.
when they're looking for residency positions. And there's a lot of gossip out there about different residency programs. And some of the comments are very specific, and some of them, a lot of them are very negative to say, it's like, oh, you don't want to go to this program. Like they'll call you
Mhm.
out if you do the least little thing wrong. And so, especially when you're looking at it and you're looking for any details about what people might be saying about your program, you start to wonder, it's like, well, who's this coming from? Like, are these from like medical students who have done electives with us? Are these from residents in our program? Or, all of the above, none of the above? And so just kind of wondering, because we basically brought it up at a residence meeting to say, do you guys do this? Like, do you visit these sites? Do you know about this? But just wondering how that might be addressed differently.
Yeah, that's even trickier, right? Because some would argue that that might not even meet the definition of gossip because you're not talking about a person, right? If you're considering who should be notified and who should be informed, well, who is the involved party? It's kind of anybody who is at the program, but it's different than somebody going onto a forum and saying Joe LaHoulier is a terrible doctor, right? That's a different situation that I think would require a much different response compared to, oh, this is not, this is a bad program to go to. I guess my only thought there would be you need more information. So how would you go about gathering that? I would go back to the potential people who are posting. If it's a forum for medical students, then I think I would kind of get into the medical students' heads. I would, try to survey them, try to get them into a safe space and ask for some honest feedback. But I think it's really tough if they're just leaving kind of generic comments about a program like that. It's hard to know, like you said, is this something specific, like a specific instance that happened? Is this a specific person? And that's sort of just the downfall of maybe social media on the whole, right? You can hide behind anonymity, which is important in some situations, but when it's not reported in the right way, like you're describing, there's really not much you can do. Yeah, I mean, I'd be curious if anybody else has any ideas about that, but ultimately I would just try and go back to the folks who could have posted it and try to, generally just say, what's your experience like? I think if you put learners and medical students in the right mindset, I think they'll tell you. We're generally pretty open in Buffalo with our leadership. I think we've cultivated a culture of of openness. I think all of us feel respected. Our opinions are valued. So I think kind of working on that and trying to get them to, honestly open up to you is probably the only option you have. Sorry, it's not a very interesting answer. I think it's a tough problem.
No, but it's definitely something that I think could use more review, more input on.
Mhm. Yeah, absolutely. Yeah, good luck. Yeah, like you said, Dr. Gerger, I think, this is something that we all have to deal with as interview season is, actually upon us right now, right? I think our program is actively screening applicants at this point. Definitely a challenge.
I have a question. I'm in pediatric emergency medicine, so I'm also in the GME space with residents and fellows. And I may have missed this sort of, but did your residents in your study talk about sort of how their content changed with how they changed or with emotional times? I mean, half of our trainees are burnt out, or something close to that. A working definition if we like survey them. And I've always, I've wondered about that as a construct. Actually, Amy, the comment you got at that a little bit of like a coping mechanism or almost like coming from a place of powerlessness. Like there may be no intellectual intent. This may be a pretty reactive, amygdala level kind of things that people are speaking. And I see that in myself too, right? So did your residents talk about that much at all? Do you think they just didn't see it, or am I interpreting that phenomenon a little bit wrong?
No, I think you got it, Dr. Higgins. That's interesting. I don't think anybody identified that within themselves, but I think looking through these transcripts, we did. One of our themes was gossip flourishes in times of burnout for folks. And I'm saying times of burnout because I think we all feel burned out from time to time. So in times of burnout, it certainly is more common to express and hear negative gossip. Yes, that is for sure something that our learners expressed. And I think that's sort of an expected result of any of us, right? When you're feeling down, it's much easier to talk negatively about your situation and your feelings. So yes, I think that's absolutely true. It absolutely came out in the interviews.
Do you think awareness of that could help what did you call it? Whatever, the gossiper versus the gossipy, et cetera? Like, does awareness of
no, absolutely
improve their gossip? If that's a thing.
Yeah. So that was identified as, a potential kind of one of the next steps, right? So how do we intervene on this process? And I think the first intervention is just talking about it, right? Identifying it, putting some words to these things that we see every day that we might not know exist, right? I mean, even just studying this for me, I mean, I see gossip 100 times a day. I should write it down. That might be kind of interesting. Just like reflect on all the times when I hear gossip and from who, but it's all around us. So I think just getting a shared language and then, maybe having a department meeting about it. All the residents, all the faculty, just talk about it. Talk about gossip you've heard, kind of acknowledge as a team, as a community, this is how we want to treat gossip. We're going to say that, talk about others should be positive and actionable, and sort of kind of take that route, I would say. But I think becoming mindful of the situation is really the first step here. Absolutely.
Yeah, that's good to hear. I think generationally too, it's a little more expected with our learners coming up now. I'm still pretty young, but I didn't grow up in the digital age. And I think that openness approach may be more palatable to people rather than the message, don't gossip. It's a hard pill to swallow for a generation that's growing up with like tons of communication all over the place, flying back and forth between them. So having an active approach, I like that. I'm going to stew on that a little bit more. Thanks.
Yeah, thanks, Eric. I think that's interesting. Even as, like a young millennial, right? I see differences in the medical students that, the M1s and M2s that we're working with, even as I'm, kind of rounding the corner on the tail end of my residency, right? Even the way they expect me to communicate with them is already different than the way I was communicated with as a medical student. So yeah, just identifying the generational piece here too is absolutely important. I agree. And it's actually kind of interesting too. I gave some of these slides to our department and we talked about it. And some of the folks who were the most interested actually were some of the really old school attendings. And they said exactly what you're saying. They're like, wow, we never would have talked about this shit when I was a resident. This is crazy, but I like it. This is good. This is a step in the right direction. So I was actually really encouraged by that.
All right. There's one more question in the chat. Why don't we take that as our last one? From Kara, does venting go under gossip or is it different?
So I think gossip can be venting, but not all venting is gossip, right? So we definitely saw lots of folks who were gossiping as a form of venting for sure. I think that's kind of maybe even our gut reaction as surgery residents. When something doesn't go right with a patient or with the case, you go back to the resident room and you're like, oh man, that did not go well at all. This attending was totally mean. They took the case away after I made one mistake. And I think that's kind of like going back to what you said, Dr. Higgins, about like your amygdala reaction, like your lizard brain. That's kind of the knee jerk before you get the higher level order processes kind of reining that in, right? I think when we all experience something negative, the gut reaction definitely may be that, right? Blame, anger, frustration. But then once we have a little bit of space to process it, we can kind of reframe things. I think, is venting good? That's a harder question. I think there are plenty of folks who say venting is not always good. Some people would argue it is. That's a tricky one. But I think to answer the question, gossip definitely can be a form of venting. Absolutely. And residents do express value in that in the study. A lot of them said, they need to at least have that external form of processing. That case didn't go well, that attending was mean. I want to just essentially just get this out into the ether, and then that helps me process. It's probably not true of everybody, thinking about like echo chambers, sometimes getting it out into the open will attract like-minded individuals and you'll sort of spiral and not be able to see things differently. Certainly potential for negative there, but I think a quick vent about a topic, that's probably a pretty common occurrence and a pretty common situation for gossip. Absolutely.
Right. Well, this has just been fantastic. I have a lot of things to think on afterwards. This has been fascinating. So, on behalf of all of us, thank you so much for joining us and for bringing this really interesting topic forward. Thank you all for being here today.
Yeah, thank you, everybody. It was a lot of fun. I hope it was interesting. Thank you, everybody.
Thanks so much. Fill out the evaluation, please, that has been posted in the chat.